Good morning, dear colleagues. I'm glad to present today the technique which I call the protocol for business lady, because maybe 70–80% of my patients, they're business lady, and their demand are that procedure should be effective, the result should be fast, and they don't want to have a long downtime, and of course the procedure should be safe. So for my patient today, Valerie, she's 48 years old, and I would recommend and prescribe her maybe 3 or 4 procedures of mesotherapy with Mesoline products. The first will be refresh with hyaluronic acids, with stem cells from plant region and coenzymes and amino acids, and I would apply it by line retrograde technique and popular technique through the eyes area and by nappage. And in the same procedure, I would prescribe the second product. It's Mesoline Tight. With dimethylaminoethanol. This is the main ingredient, also silicium, just to underline the mandibular line. And also we know that dimethylaminoethanol as a precursor of acetylcholine will also create very good tonus, and I inject it deeply till the muscles, till the projections of the mimic muscles. And this will be 3 procedures, and on the fourth procedure, I would like to fix the result. And as a demand of my patient, as maybe 90% of our patients is, they see only nasolabial fold. So I would prescribe for her very natural and slight augmentation of the medial part of the cheekbone, and also lifting her eyebrow, just the lateral part of eyebrow, by fulfilling the temple. Because she is very thin, and such morphotypes gets us skeletization. So just to remove the signs of aging, I would prescribe her also the injection to the temple. And to satisfy my patient, I will fulfill, of course, in their last procedure, her nasolabial fold. So the product which I choose will be Pluryal Volume for mid-cheek and for temple, and Pluryal Classic for nasolabial fold. So let's pretend that it's our fourth procedure from the protocol, and I will start from Pluryal Volume. So to lift the eyebrow, I would perform gunshot technique. Could you please do like that? So, which dangers we have here? Of course, here is arteria temporalis, nervus facialis, the brand of nervus facialis, and of course a lot of veins which goes through their 2 layers of temporal fascia. And for such a skinny patient, we can see these veins. The injections will be very deep through the skin, temporal fascia, through the temporal muscle till the bone. And it calls gunshot technique. So breathe. I just take, okay. We go till the bone. Is it painful?
No.
No. So, and I start injecting. So I will inject 0.2. I start injecting, and patient will feel some pressure a little bit until 0.2.
What size needle are you using for this?
The needle is 27 gauge needle, which goes with the product. So for this, and to just to know where to inject, here is the temporal crest and the zygoma. I ask my patient to bite a little bit just to feel the temporal muscle. And I also explain that after these injections, she will feel a little bit uncomfortable for one day when she will eat and bite, but it will disappear, and as you can see, it's very slight injection and the fulfilling. So I inject 0.2, and now I proceed to injection in the mid area. Of course, here also we can see the infraorbital superficial fat bags. So not to increase it, but to mask it, I would prefer to inject and to fulfill the cheek. And for natural injection, I ask my patient to smile, please. Yes, and you see the apple of the cheek, very natural. So the main, I would say, the apex of the cheek here and here with the smile. Okay, relax, please. So I would like to create volume just natural here and here. So I will inject. Okay, breathe. Just under the infraorbitalis nervus, infraorbitalis fat pad, and laterally to infraorbitalis nerve. Is it painful now? No, I am standing on the bone and injecting. With injection, my patient also will feel a little pressure, and I inject 0.3, 0.4. Okay, so, and we see immediate result. So we mask the infraorbital fat pad and smile, please. And you see the volumization of this area. Also, the apex of the cheek of the lateral part is here. And to lift the nasolabial and to fulfill all this area, I will inject in the apex, but very naturally. Okay. Yes. Till the bone. Is it painful now? No. Because if patients say that it's very painful, so it means that you reach the vessel or you're very, very close to the nerve. And inject slowly, slowly, 0.4. As the product is make the form very good, but it's moldable and has very good cohesive capacities. So we can make not the massage, but the sculpturing. And some of my patients said that you are like the sculptor. Okay, so now we can see the result from here. And can you smile, please? And it's very also important to make their picture not only in static but also in dynamic and show it to your patient. And I can see the result from the TV. I don't know if the audience see that.
We see, Vladlena.
Okay, thank you. And now I will proceed to nasolabial fold with Pluryal Classic. So this is more, I would say, plastic material, softer, but also has very good cohesive capacities. And you can see the nasolabial fold, the main demand from my patient from this and from this side. So just to fix the result, I will inject, breathe. I always ask my patient to breathe, and you can see where I am, just subdermally. And very, very slowly I inject, because it's not very pleasant region. Okay. The same, because we know all dangers here, and the main danger is the fascial artery. Okay. And smile, please, a little bit if you can. Can you be closer, please? Closer here, yes. Okay. Okay, relax. And now, yes. also. So 0.5 for nasolabial. Sometimes I also fulfill the corner of the mouth just a little bit. Yes, I have the product. Okay. We didn't put any anesthesia here, but the product has lidocaine inside. Okay, so, and after I will proceed to mesotherapy. Just if we pretend that it's the fourth procedure from the protocol, I will use Mesoline. I will use Mesoline Refresh for the periorbital area by popular technique. To hydrate the skin, to reduce wrinkles, to tighten the skin, because inside is hyaluronic acid and plant stem cells of plant region, amino acids, coenzyme Q10. So for this region, also I can be very, very superficial on the nasolabial fold. And you can see this papillus, or you can be line retrograde technique used on this region. And also for all the skin, it will be very good with nappage technique. So, and this technique, of course, I perform without any anesthesia. And you see little spots of blood. So this is the nappage technique. And also you can continue with the neck and with the décolleté. And now I will proceed to tight. Tight, from the definition of the product, contains dimethylaminotenol, silicium, so it's very good for tightening and also work with the muscles. So I prefer to be deeper. So I pinch the skin and inject the product. As the methylethanol has a heating or burning sensation, I tell my patient that she will feel, of course, this product. The first product is very comfortable. Yes, you can pinch or you can inject like deeply. The needle is 4 millimeters, 33 gauge needle. It's the first procedure for my patient. So, and she is very, very good. No complaint. So for one side, I use approximately 1 or 1.5 ml of this product. For mid zone and for lower zone. Also, you can use this product by nappage technique. So you can use 2 or 3 products in the procedure, in one procedure. It depending on the demand of the patient, of course. And this product also very good for neck, for definition of the neck. And can you be here, please?
Do they get much swelling from this or no?
Sorry?
Do they expect much swelling afterwards?
Much swelling. It depends on the patient, but from this product, not so much. For the first day, yes, hyperemia can be maybe till 30 minutes, and swelling maybe till 2 hours. That's why my patient prefer to make this procedure in the evening. And for the neck, it's also very good just to tie the skin, because this region is very hard to treat, even with botulinum toxin. So to inject here also deeply without any anesthesia. And also you can use this product for acupuncture technique, pharmacological acupuncture to, to stimulate some bioactive points. So the protocol for business lady, and the next day she will be okay and she can continue her work. So as you can see, can you be a little bit close, please? to the face. So you can see that she's quite fresh. And after that, I will apply cream with hyaluronic acid or with arnica, with dexpanthenol, whatever you prefer, just to give the comfort to my patient. Okay, and I finished. And you have questions?
Thank you, Vladlena.
Thank you.
Like this. Can you put
Some questions.
from here and?
Vladlena, how often do you use this mesotherapy?
I use it all day in my practice, in my office, and I use especially this product for 8 years.
Okay, thank you.
Thank you.
Thank you.
Hello?
Our question?
Okay, so my question is, if there was a danger for the facial artery to penetrate by the hyaluronic acid, why the doctor was not plunging back the filler?
Not aspirate, you mean?
Yeah. Why not plunging back? And another thing for me, I think it's quite superficial in the nasolabial, so it can give a Tyndall effect. And you cannot massage it very properly. And the other
I didn't hear, yeah.
Okay. And the last question is, this technique is quite new for me, the massage technique that you have used for the infusion of the product. So what I can see, it was just a droplet on all the face. How can you diffuse it? You know, by puncturing it, okay, it's something good. It is like a microneedling. But how can you diffuse it if you're just putting the drop on the surface of the skin? Why not to inject it?
Okay, thank you for your question. So it's two parts of the question. Of course, I will massage a little bit the nasolabial fold with the Pluryal Classic, but can you open your mouth, please? But as I would like to proceed to mesotherapy, I didn't perform it just right after. And here, can you be closer, please, to the nasolabial fold? From here, yes. So, of course, I always massage it, and as I was not so deep, and as you know, facial artery goes in 70% a little bit upper than nasolabial fold, and I can see from here, and just pretending where is it. So we divide this distance from the mouth till the angle of mandibular to divide it to the twice, and ask our patient to bite. Bite, please. So the facial artery goes in premasseteric area, and before my procedure, of course, I make the marcation of the vessels. So it goes like this here, because if, for example, masseter is too big, so artery will go very, very close to the nasolabial fold, and you are right that we should avoid it. And I was not very very superficial, so I was subdermally here, and my injection point was like this, so not just a line retrograde, but a little bit diagonal. So I was quite sure that I'm safe. But if you're not sure, of course, you can aspirate before injections. The second part of the question with diffusion, the nappage technique, needle goes intradermally, and the product goes intradermally and on the surface, and you widespread it like you said, right, like a microneedling technique. So micro punctures around 1 millimeter depth, so the product goes inside, and we stimulate all epidermis. So, and dermis, as you can see, the mechanical stimulation, not only stimulation from the product, and hyperemia now just a little bit, but that exists. Thank you.
Thank
Thank
you.
you so much.